Ever wondered what the most common diseases and disorders are that affect people globally? Today, we delve into a few of these conditions, dissecting their causes, symptoms, and treatments. We'll explore 3 prevalent conditions: diabetes, heart disease, and depression. Each one, in its own way, significantly impacts the lives of millions worldwide every single day. It's not just about understanding these conditions for academic or professional purposes. It's also about raising awareness and understanding the experiences of those living with these disorders. This knowledge can help us empathize with their struggles and can guide us in making informed lifestyle choices to potentially prevent or manage these conditions. It's a fascinating, albeit sobering, journey into the world of common diseases and disorders. It's a journey that promises to be as enlightening as it is important. So, without further ado, let's delve into our first disease, diabetes. Diabetes, a condition that affects millions worldwide, is our first stop. But what exactly is diabetes? Let's begin with the basics. Diabetes is a chronic disease that occurs when your body either can't produce insulin or can't use it effectively. Insulin is a hormone that regulates blood sugar, helping to keep our energy levels balanced. With diabetes, the body's inability to use insulin properly leads to elevated blood sugar levels, which can have serious health implications if left untreated. There are 2 primary types of diabetes. Type 1 diabetes, often diagnosed in children and young adults, is an autoimmune condition where the body mistakenly attacks the insulin-producing cells in the pancreas. This results in the body's inability to produce sufficient insulin, necessitating daily insulin injections or an insulin pump to manage blood sugar levels. On the other hand, type 2 diabetes is more commonly diagnosed in adults and is associated with insulin resistance. The body still produces insulin, but it's not used effectively, leading to high blood sugar levels. This type is often linked to obesity and lack of physical activity. Now, you might be wondering, how do I know if I have diabetes? Common symptoms include frequent urination, increased thirst, unexplained weight loss, fatigue, and blurred vision. If you're experiencing these symptoms, it's crucial to consult a healthcare professional for a diagnosis. Once diagnosed, managing diabetes involves a combination of treatments. Insulin therapy is a common treatment for type 1 diabetes, while type 2 is often managed initially with dietary changes and exercise. As the disease progresses, medication or insulin therapy may become necessary. Beyond medications, lifestyle changes are a key component of diabetes management. A healthy diet, regular physical activity, and maintaining a healthy weight can all contribute to better blood sugar control and reduced risk of complications. Remember, early detection and proper management can help people with diabetes lead a healthy life. Next, we move on to another prevalent condition, heart disease. Heart disease, also known as cardiovascular disease, is a leading cause of death globally. But what triggers heart disease? It's a complex condition, and the answer isn't as straightforward as you might think. At its core, heart disease is a catch-all term that encompasses a variety of conditions affecting your heart structure and function. This can include issues like coronary artery disease, heart rhythm problems, and heart defects you're born with, among others. Now, what about causes? There's a multitude of factors that can increase your risk of heart disease. Unhealthy habits such as smoking, consuming a diet high in saturated and trans fats, and leading a sedentary lifestyle can all contribute. These behaviors can lead to conditions like high blood pressure, high cholesterol, and obesity, all of which are risk factors for heart disease. So, how would you know if you have heart disease? Well, symptoms can vary widely. Some people may not even realize they have it until they experience a heart attack. Common signs can include chest pain or discomfort, shortness of breath, and fatigue. In some cases, symptoms can be more subtle, like indigestion, heartburn, or even a decreased ability to exercise. Treatment options for heart disease are as diverse as its causes and symptoms. They can range from lifestyle modifications to medications, and in more severe cases, surgical interventions. Lifestyle changes can include quitting smoking, adopting a heart-healthy diet, and incorporating regular exercise into your routine. Medications may be prescribed to control symptoms or slow the progression of the disease. And in severe cases, surgical procedures like bypass surgery or stent placement might be necessary. The truth is, heart disease can be a silent killer. It can sneak up on you without warning, and the first sign might be a severe event like a heart attack. Therefore, regular checkups and a healthy lifestyle are crucial. Finally, we explore a mental health disorder, depression. Depression, a common mental disorder, impacts daily life significantly. But what causes depression? There's no single answer. It's a complex disease with multiple contributing factors. One of these factors is genetics. Just like hair color or height, our genes play a part in our susceptibility to depression. If a close relative has suffered from depression, your chances of experiencing it may increase. Personal life events are another major contributor. Traumatic experiences, such as the loss of a loved one, can trigger depression. Prolonged stress, like financial hardship or relationship troubles, can also lead to this debilitating condition. Biochemical imbalances in the brain are a key factor as well. Our brain uses a variety of chemicals to regulate our mood. When these chemicals are out of balance, it can result in feelings of persistent sadness, a hallmark of depression. Depression manifests itself in several ways. Symptoms include a continuous feeling of sadness, a loss of interest in activities once enjoyed, and difficulty concentrating. It's not just an emotional state, but a physical one that can lead to changes in appetite and sleep patterns. But there's hope. Depression is treatable. A variety of methods exist to combat it, including psychotherapy, where individuals can talk through their feelings with a trained professional, and medication, which can help balance the brain's chemistry. Depression is real and treatable. Never hesitate to seek help if you or a loved one is struggling. Today, we've delved into 3 common diseases and disorders that affect people worldwide: diabetes, heart disease, and depression. We've unearthed their root causes, unveiled their symptoms, and explored the various treatment options. Diabetes, a lifestyle disorder, heart disease influenced by numerous risk factors, and depression, a mental health concern, all require our attention and understanding. Remember, knowledge is power. Understanding these conditions can help in early detection and treatment. Stay informed, stay healthy.